Today's topic is: what is a seems to be harmless symptom that requires an immediate trip to the ER? Sudden change in vision. In my case, it turned out to be a brain tumor. I waited too long and now my vision loss is permanent. But I went early enough to still be alive. Headache and a neck so stiff that you're unable to look straight up. Sign of meningitis, inflammation and swelling of the brain, that has gone so far that your brain is pressing down on the brainstem. Could be lethal within hours. A migraine that's much more painful than usual. Apparently a stroke is not always accompanied by the other well-known symptoms. I'm on blood thinners now. Superficial burns to the face, typically from barbecue or stove lighting accidents. It may seem like just some singed eyebrows, but if you were inhaling at all when the accident happened, you could have burned the inside of your throat. Most people present with normal breathing, but as the injured tissues swell, it can close the airway. Most of these people feel fine directly following the accident and end up intubated if they make it to the hospital. I had an infection in my toe, ingrown nail, when I was 16 or so, and they gave me antibiotics. The next day in school I developed a fever of 104F, my leg went numb, and the skin on my leg was discolored and hot. The antibiotics they gave me weren't working for some reason, the infection went up my leg, and I developed cellulitis. They gave me different antibiotics and those worked. But at the urgent care they told me if we had waited any longer to go in I could have needed 4 antibiotics. If you have an infection and start developing new or worsening symptoms, despite being on antibiotics, talk to your doctor or go to urgent care ASAP. My stomach was bloated for 5 days. I saw my general practitioner. He did an ultrasound right then and saw fluid in my stomach, which usually indicates cirrhosis of the liver or advanced stage cancer. He told me to go to the ER, where I was diagnosed that night with advanced stage ovarian cancer. Prolonged breathlessness. Mine turned out to be a serious pulmonary embolism. Lucky to have survived the 6-hour wait for treatment. Being tired all the time, suddenly. Last year around the fall we noticed my dad getting tired really easily, needing to sit down when going for a walk, sleeping in way later than usual, etc. He had gained some weight, so we told him he should lose it cause it's obviously affecting him. Even our doctor told him he should really watch his health and eating habits if it's causing him discomfort. It got to a point where we got blood tests done to see if he's pre-diabetic or something. Then they noticed he's got really bad anemia, and very very high iron levels, which is unusual. They sent him to the ER for an emergency blood transfusion, where he met with a hematologist who immediately told him it looks like his bone marrow basically stopped working. After a week in the ER they diagnosed him with MDS, a form of blood cancer, and his only way of survival was a stem cell transplant. He got very lucky that they found a 100% matching donor fairly quickly, and he's seemingly recovering now. Always go to the doctor. Not really a symptom per se, but if you have received an electrical shock. Even if there aren't any electrical burns and even if you feel fine, there is always the potential that a shock could send your heart into an irregular rhythm which could end up fatal, so best be on the safe side and go get checked out / have an EKG done. If your neck pops and you suddenly feel lightheaded, that gets worse. My cousin was driving to work and turned his head to check for traffic. His neck popped on its own and he felt weirdly lightheaded after. When he got to work a few minutes later, he told his boss what happened and collapsed. Boss called an ambulance. It turned out that he tore an artery in his neck. Fortunately, he survived. This is why we're told not to crack our necks, either ourselves or during an adjustment by a chiropractor. If you hit your head hard, go to the hospital. If you fell, if you knocked your head against something pretty hard, if you got your shit rocked in a fight, if you got hit hard while playing sports, etc. Doesn't matter if you think it wasn't that bad or you're getting up and walking around, you should go to the hospital. It's one of those cases where it's truly better to be safe than sorry, because it could be anything from nothing to something requiring immediate hospitalization, and it could be as serious as a brain bleed that's not going to result in symptoms until it's too late. If you get hit hard in the head, go to the damn hospital. Sore calf muscle. Thought I overdid it during a workout, but light stretching, heat, massaging it, etc., all seemed to make no difference. Didn't really limit any movement, didn't hurt any more after any specific motions, it was just sore. A month or so later I started getting short on breath far too easily, even after just a short, easy walk which was far out of character for my usual fitness level. I'd had a nasty cold, didn't test for COVID, thought maybe it was after effects. Didn't realize until later, after I finally passed out for 3 minutes after climbing a flight of stairs, then a hospital trip for x-rays, CT scans, and more, that these things were connected, the result of a blood clot that had probably started in my leg and eventually lodged somewhere in my chest. And so began my month in the hospital. We still don't know what caused the blood clot in the first place. Haven't had any recurrence since, 1 year later, hopefully just a one-off fluke. A constant, runny nose. Especially if it's clear, watery, and coming from only one nostril. Especially if it gets worse when you strain or stand, improves when you lie down, is kinda salty/metallic tasting, or is accompanied by new headaches, neck pain, or light sensitivity. That's your cerebral spinal fluid. That shouldn't be on the outside of your body. Edit. Before you go to the ER for a runny nose, wipe your nose with a tissue. If the tissue stiffens when it dries, that's snot. You're fine. Being nearsighted and all of a sudden seeing what looks like lightning in the bottom of your eyes. Part of your eye is ripping and you should go to the ER/ED immediately. It's rare, but I did not enjoy learning this from my optometrist. But good go no. Hopefully most people know this, but a bite from any animal, not just wild or rabid-looking animals, I mean even your neighbor's dog, if you don't know if the animals is fully vaccinated, documentation would be best, go to the ER for rabies vaccines. A friend had a cut on her finger and did some gardening. It got a little infected, so she used tubbing alcohol and Neosporin. It stayed infected for weeks. When she finally went to the doctor, they discovered she had a rare bacterial infection from something in the soil. After 6 surgeries, they amputated that finger and the one next to it. She almost lost her whole hand. Funny you should ask, as I'm in the ER right now. Bruises. I have several bruises that I tried hard to explain away. My wife is a PA and also noticed red dots in some areas of my skin. She said either alone is nothing but both. Turns out my platelets are critically low. 8K, I'm 54 and live a normal healthy life. The reason is unknown, but basically my blood will not coagulate if there is a wound, and this low can spontaneously bleed. If you're eating/drinking and start to get red lines coming out from your lips or down your neck. A precursor to your throat swelling shut due to an allergic reaction. A cut on your foot if you're diabetic. My former roommate is diabetic and at the time very heavy and not taking his condition seriously. He stepped on something small, a pin or tack maybe, not sure, he knows. He said it hurt a bit, but only for a minute or two. He started to have pain but attributed it to a flare-up of gout. Then he realized the pain was only in his toe. He went to the hospital and they told him that the wound was necrotic, and since the rot had hit the bone they had to amputate his big toe. Sudden onset of diarrhea that won't go away. A lady I work out with had diarrhea for months after the holidays despite being a healthy eater, working out and not drinking alcohol, etc. Luckily her doctor ordered some specific tests and they found stage 1 pancreatic cancer. It's quick to progress and is usually diagnosed much later after symptoms have gotten really bad, so she's incredibly lucky she caught it early. She had a successful surgery and is doing 10 rounds of chemotherapy just to be safe, but her oncologist is optimistic that she'll make a full recovery. I got what felt like a sunburn on my face, only it hurt tremendously with just the ceiling fan blowing on it. Decided to go to urgent care, which I never do. And it ended up being shingles and went into my eye. If I hadn't gone to urgent care, I would have lost my vision in my right eye. Losing consciousness for any reason other than going to sleep or known seizures. My wife, 34 weeks pregnant, had a routine appointment at the hospital. Thank fuck it was the hospital. She mentioned that she hadn't felt the baby moving as much in the last day or two, figured Bubs was tired. Initially she wasn't going to say anything, didn't want to trouble them. The nurse there decided to do an ultrasound, just in case. Result, placental abruption. That baby had to come out now or it'd die, probably my wife too. Thankfully both wife and baby were fine, baby just a bit undercooked. Diarrhea, nausea and vomiting. I've seen patients come to the ER thinking they have a stomach bug when in fact their abdominal aorta, a major artery, ruptured and they require emergency surgery. Vomiting that's dark, like wet coffee grounds. Get to a hospital. It means you're bleeding into your stomach. Feeling of overwhelming, approaching doom. That you'll be okay if you lie down and sleep. Hospital. It can be heart or brain. In older folks, it's usually a sign of stroke or heart attack. Ingrown cuticle. My cuticle was cut funny at a manicure. It hurt. So I threw some alcohol on it. A couple of days later, when we were headed out of town, I noticed it was swelling slightly and started looking red. I cleaned it with hydrogen peroxide and threw Neosporin on it. Several hours later, I was squeezing out thick pus, and it was hurting. The skin grew red, the pus yellowish green, and blood came to the surface that was hot. Went to urgent care feeling stupid. They drained it, gave me an antibiotic shot, put me on oral antibiotics, and told me if it got worse I would need an IV and to go to the hospital. He told me don't ever wait like that again or I could lose a finger. Or worse. It was 2 to 3 days from the original cut, and within 24 hours from the initial swelling to really bad. Don't mess with hidden, painful cuts, no matter how little.